The main message from Sprint Mind is that for the first time we've shown that what is good for the heart is also good for the brain. So I think that's the top line message for all practitioners as well as the public. But in a more detailed fashion, Sprint Mind showed that the blood pressure target of 120 systolic is more effective at reducing the risk for developing mild cognitive impairment than a blood pressure target of 140. So this is the first time really in history that any treatment has shown to reduce mild cognitive impairment. Sprint Mind did not show a reduction in dementia that was significant. It showed a 15% non-significant reduction in the occurrence of dementia in, again, the intensively treated group. One of the main questions that was outstanding still was, is blood pressure lowering safe for the brain? And so Sprint Mind clearly shows that it's not only safe for the brain, it's actually beneficial to the brain. So, and this is a very important point for clinicians and their patients. I think the other important thing to note is that there are many biologic phenomena that show that a lower blood pressure or a lower weight without the context of being treated may be harmful. So people whose weight is falling or low without trying to lose weight, that's a sign of poor health. But people, and the same for blood pressure, people whose blood pressure is low without any treatment, that's perhaps a sign of poor health, especially in older people. But in the context of treatment, lowering blood pressure can be very beneficial. And so this is something that physicians and their patients will need to discuss. One of the important things to note about Sprint is that although we did not see a significant reduction in dementia, one of the reasons we believe for this is, first of all, that we were unable to follow the participants for a long enough period of time. It was just short of 5 years that we were able to follow the participants. And then also the other important thing is that this intervention was stopped about halfway between the second and the third year. So if we'd been able to continue that intervention, perhaps we would have seen a significant effect. But there's a silver lining to this as well, in that only 2.5 years of blood pressure lowering produced the first ever intervention that could reduce the risk of someone developing mild cognitive impairment. So that's a bit of a two-edged sword, but I think very exciting.